Let's call this meeting to order, please, and the time is probably 5:40 now. 39 still, good. Are there any public comments? I don't see anyone from the public. Approval of the minutes, we got them in email. I'm not sure if everybody read them.
No, in order, I move that they be accepted and approved.
I'll second.
We have a first and a second. Any discussion? Call for the question, all in favor?
Aye.
Anyone opposed? Motion passes. We go on to discussion and possible action. We have an update on the meeting with commission members. Colleen and I attended as commission members. Then we had Mayor Sines and the hospital representatives. It was the two hospitals and the specialty hospital, fire department, police department, and us, the commission. Dr. Gonzalez, Colleen, and I. So he wasn't able to make it, but thank goodness Colleen went. So Colleen, go ahead and give the update on that. I'm gonna read the other one from the training.
Yesterday, I came actually to the training, and so then after Dr. Gonzalez had offered if I could make it, and I said yes. It was a really great opportunity to hear from the hospitals that they want to be able to help. They just needed to have the clarification as to what we require them. Dr. Gonzalez had suggested maybe perhaps staff to fulfill the detox center. The city is looking at maybe fulfilling some of the brick and mortar, the renovations or things of that sort. And it looked very good that at the end, the CEOs were considering to coming into a commission meeting, not this month, but for June, to schedule them so that they can tell us what their concerns are with regards to the detox center. When asking about the specifics, they were asking, okay, the dual,
MOU.
well, actually, the dual, I'm looking for the word. Diagnosis, yes, the dual diagnosis. Whether an individual has to detox and has a behavioral problem, or has a behavioral problem and doesn't need to detox, or there's the ands and the ifs and the in-betweens. And so that's what they wanted to know, what scenarios are going to play into the detox center that the city and the county will be providing, and if not, are they still going to be within their hospitals? And so those are all questions that they had, because they said that there's been one instance recently that they had a patient that was there for 17 days. And those patients don't pay the hospital, and so, you know, that's their concern. So it looked very good. They were somewhat excited to say that they want to partner up, but they need the details as to what the detox center is wanting to offer them. What is it that they want? And so Dr. Gonzalez, like I said, mentioned, if you have staff, can we fulfill, can you all fulfill that staff salaries and things of that sort as a partnership? And so they just said, let's go back and find out who we've serviced within with the needs of the detox center, and then we'll come back to you. So they said that they would present in June.
Thank you. Yes, it was an eye-opener. They said they were gonna run some numbers and see how much exactly was lost by attending to all these people. You can't just let them die on the doorstep. And so they were interested, but they weren't as gung-ho as the team before this, as I understand. So yes, it went well, and let's hope it does come through. I would love to have this all done and started on by December, because the longer we stay, what happened last time, as Dr. Gonzalez has said, was everyone said yes and they were all ready to go, but then it was election time because they had taken so long to get this started, that then when the commissioners changed the councilman changed, then it was new people on the board and they didn't agree, and so it all died. So we need to get this done before another election. Yes. That's what we're heading towards. Let's hope that that's the way it works. Thank you, Colleen. Okay, we do have, I want to mention, even though it's not here on the agenda, Mr. Ramirez, right here. Everybody have a big hand here. Nobody could find the original blueprints from the beginning of time. It was actually 1987, did we say yes? 85, and then it was amended to 87. And you can tell by the color of the paper that it's pretty old. And so now we do have the real blueprints so that everyone can, there's something about the blueprints that we got that they couldn't work with.
They want to scale it.
Something. So now at least we have the real ones, and now we'll leave them with Dr. Sedlin. I think Dr. Gonzalez is out of town. And maybe they can start getting their, all those little acronyms, little things that, what is it, Madam? RxQs? There, okay. They can start on that because they didn't have the right stuff. So, that's another one, good.
Yeah, thank you.
Thank you, sir. And then we need, I'm supposed to give an update, it's not on here. But I'll give it anyway because I have all the notes.
For training?
Yes, there was a training here yesterday, as Colleen mentioned, and she and I showed up for the opioid overdose training. And it was many, many pages of notes, but Dr. Gonzalez and Dr. Serra cut it down to 1 page, yay. I'll just read it pretty fast for you, and there is gonna be another training for us in May, I think he said 17th or 18th, at the UT Health Science Center. And whoever can go is invited. He'll send us information. For the last 10 years, the increase on opioid overdose related fatalities has increased more than 400% nationwide, and in some areas more than 900%. Wow. Yes. Laredo had in 2016 33, in 2017 43, and in 2018 27 OD deaths. Never allow drug users to both of them use at the same time. In other words, it's very dangerous. Sometimes it's got other medications that they are not aware of, or other meds, or other illegal drugs, and they both overdose at the same time. So if they're using it, we should never let, if you have someone in your family, use them at the same time. Do one and let the other one watch them or whatever. Of course, we're speaking to people who may not pay attention to us, but there it goes. This is linked to the use of new forms of opioids as fentanyl and carbafentanyl. Okay. Naxalone, naloxone. Naloxone treatment can be used for any type of opioid overdose, and it's a safe antidote with no side effects, which is the same thing as Narcan. Okay. The Narcan is the one that you spray in your nose. Y se acabó. They are supposed to.
Wake up.
Yes.
Wake up.
Training should be focused on people living with users or users themselves. Texas ranks number 50 in access to treatment facilities and detox centers in the U.S. Number 50, bottom, last.
Yikes.
The end. Change the focus on the message to user engagement instead of prohibition. Use connection and support. And by the way, the guys who presented this were both ex-users. And one of them was a faculty member at Yale, and the other one in Austin. So they changed their lives. Let's see, we go on to the number one negative factor for opioid user engagement is stigma, especially from healthcare providers. They don't want to work with them. Encouraging opioid users and partners to undergo training on naloxone use is the most effective way of preventing fatalities. Naloxone can be safely used by anyone with simple training, and it was very simple. If it's not opioid use, Naxalone won't hurt you, but if it is, it can save your life. So if you use it and it's another drug, no se hace nada.
Oh, I
They're
see.
fine.
Oh, okay.
Opioid overdose should be recognized by all involved or living around people who use it, and it is expected that the opioid crisis will get worse, of course, before it gets better. So that's in the very short summary, because there were like, I don't know, 10 or 12 pages of notes.
And it was very good because the morning, the training was open to the health professionals here within the city, and then in the afternoon, it was open for first responders, our police officers, and our fire department, paramedics, and firefighters. And so they sometimes are the ones that
They're the first.
initially, you know, for the first responders that go to these types of calls. And so they may be able to save a life. So it was interesting. These numbers are very shocking when it comes down to it. And then when we, I think they have talked about over 1,000 calls in the last year, if I'm not mistaken. But it's just, it's an impressive number, because we're talking about our community and that this is a problem. This morning I was waiting to get my tire changed. I had a flat tire and I was at the Firestone, and on the news they were posting, or they were talking about how children have a problem of addiction when they're going to the dentist or they're going to the pediatrician, because the medicines that they're giving them to, you know, whether they're doing like a root canal or one of those like dentistry procedures, they're giving them this medicine, and so they may become addicted to it. So they're cautioning dentists from actually giving children opioids so that they don't become addicts when they get older. They don't know, and so it affects their mindset. And so it's the problem is real. So whatever we do, however we do, we need to be able to do something for our community. And I think that the training is a benefit for all of us, and no matter what field we're in.
And in the newspaper today, I'm sure you already saw that, who is it, Pillar is going to be giving out
Oh, yeah.
those
Training.
Yes.
Yeah, their
Free.
trainings on 14.
Training and the
And the antidote, yeah,
Mhm.
the naloxone
the spray.
spray.
So I think if we all can go back to our social medias or talk to our friends and our families or organizations or groups that we're part of, to let them know that they are able to take advantage of this free.
And the misconception about the powder, tell them.
Yeah,
Oh,
let's ask Dr.
well, one of the stories that they told us, it was yesterday in the afternoon, that law enforcement, they do have boxes and boxes of naloxone, but they never use it on people, they use it on themselves. Because whenever they do raids or they get drugs, they usually use because they're afraid of getting intoxicated themselves.
It's a misconception.
But that's a misconception.
Yes, there was
It's a myth.
lots of stories. You
It's a
heard
myth.
that on the news, right? Newspaper, I saw it on internet, that several policemen had to go to the hospital because they had touched something and then they started feeling ill because somebody told them, well, that's gonna kill you. So then psychologically, they got all
Psychological.
anxiety.
It had a
But
scare
there,
like the
there is some
anthrax.
truth to the fentanyl.
The
Because then
fentanyl.
if
Fentanyl
they're
for
working
sure.
on fentanyl and the other fentanyl that's used on elephants, which is
Yes, yes.
1,000 times as strong.
But what is the truth?
The truth is that if they're fabricating it in a house or it's
If
left
they
on the counter,
inhale, yeah.
inhale or even touch.
No,
That's how
touch,
sensitive.
touch, no.
Yeah, but they touch and they do mild.
If they do that, yes,
Okay.
but
They're
if
checking
they
to see
just
what it is.
touch, it's not gonna happen, yes.
It should not become like an airborne disease.
Kind of, but now it has
But
to
the
be
thing is-
inhaled or vaporized.
That's not
They
a
have
lot of
to
brain on it.
inhale or
No,
ingest.
not-
But it's that potent that if it does have
Okay.
contact and they
Contact,
ingest
no,
it,
contact, no.
Okay, no.
Like inhale or.
Inhale.
Yeah, but
I think it's similar to when we're on the verge of the HIV epidemic.
oh yes.
Nobody
Nobody
really
wanted
knew,
to touch
and
it.
everybody's
Touch
just
it.
heard, and everybody's saying, and it's just, oh yeah, it can be psychological, and you just don't wanna have anything to do with it.
So anyway, they reported on that, and then they showed us all the other things that are available, a shot in the tongue, which I wouldn't, no,
No.
let me die. I don't want it in my tongue, and so on and so forth. And so they showed us how to prep it and all this stuff, and it was very interesting, but I'm glad I don't have to work with that stuff. It's dangerous. And then your chief yesterday said, because Dr. Gonzalez said, oh, we gave a bunch out to your guys, and he says, I don't want them to use it. So, you see, okay.
He
Yo
doesn't
no me
want-
metí, have it like,
But why doesn't he want him to use it for that same misconception?
I don't know if that was accurate.
no.
He said
it
because
was
they're
like-
using themselves, they use them on themselves,
They
They
don't
would
get it.
use them on themselves.
on the police officers.
That the police officers use
Yes.
it themselves?
Yes.
For what?
Whenever they get.
For an exposure.
For an exposure,
For an
yeah.
exposure. So I think it's more about having the proper training.
Yes.
Correct.
And
Right.
if we are gonna deploy them, there has to be a training and a
Yes.
use protocol.
Right, yeah.
Well, it was only 30 cops, I think. It was 30 from them and 20 from the other, right? Fire. It was 50. He mentioned a number of 50. Only 30 that got it.
Yeah, training is gonna have.
And they gave out kits. Did you bring yours? No?
No, I haven't in the.
They gave
file.
out kits too. Didn't take it.
I should have told you.
Yeah. Okay. Then we go on to work group reports. Colleen?
In regards to the prevention outreach and education, I apologize, I've been missing for the latter part of April. My mom had gotten sick, so I wasn't able to get together with the group, but I have been in communication via email. I know Brianna's working on getting some pictures for the collage that we're wanting to work on, so that if we ever have the opportunity to go and do presentations out of the community, that we're able to talk to people, to the public. Steven's also getting some information and has worked on a couple of things with Judge Gaviana's office in regards to statistics, and so those are also going to be either put on our Facebook or be put on the collage that we're working on. Ms. Quintanilla has produced a script for a Don't Drink and Drive PSA for graduation. We've been in touch with PAC in regards to having to film that and get that on our media stations, and so that will also be brought forth to our Facebook so that we are able to just bring more awareness to the community. We had talked about different things, getting together with the Parks and Recreation and some of the events. They said that they would open up the invitation to us when we are ready to go out, and maybe perhaps some of the commission members are able to set up a booth and just, talk to the community and or work with stakeholders to present at different events that they may have. We had talked about a mall event because the mall has the greatest population on our weekends, because that's where people tend to go, and it's a family environment. And so I gotten in touch with the mall, and they had said that in order for us to set up in the area to either create an event or have the stakeholders present with a table and just disseminate information, it would cost us $400. In talking to Dr. Gonzalez, the commission doesn't have that money, so we will have to look for an alternative if we still want to continue to do so, and just get the word out there. Alcohol Awareness Month,
What's gonna cost $400?
the rental of the space for the mall.
Oh, so they won't volunteer?
They used to. Not
They won't
anymore.
lend it to you?
But he did send us an email that it had been approved by the city to give us $400 for it.
He did? I didn't get that email.
Yes.
Oh, very good.
Okay. Okay, then that's good. I didn't get that email, so that's why I wasn't able to.
Okay, I thought it was sent to all of us. I'm sorry.
Well, check on that,
Yes,
just to make
yes,
sure,
he
that
did.
I didn't think
I've got
I
it in
saw
my
it.
email. I don't get anything.
Yeah.
Day one, I have it in there. So, yes, thank you. So we're working on all of those things with the work group, and let's go on to the next one. The next one is the intervention, treatment, rehabilitation. David Moncada, no. Graciela Martinez Vela. Kelvin Stillman. Gabriela Perez. Enrique Manrique. Nancy Cadena. Mara. Have you all met?
We have not met, actually.
Okay.
What is that group?
Intervention, treatment, and rehabilitation.
Rehab.
Yeah, I can send an email out so we can meet in the near future.
Okay, thank you.
Can you put me in that group?
You are?
Sure, well,
I'm in the group.
Dr.
All right.
Gonzalez was gonna put everything
Javier
in.
Ramirez, you're.
Yeah, all right.
You're the last one right after Mara,
All right.
because you're the last one added,
Yeah.
right?
You have
Yeah.
this one?
Yes. Thank you.
Okay, then we go on to detox, transitional support. Again, Gabriela Martinez.
You're in there too.
Vela, Gabriela Perez, Enrique, Nancy Cadena, Jesse Hernandez, no, didn't show. Margarita Garza, Mara.
I don't have an update as far as that's concerned, only because when the county met with the city, there's a lot of loose ends that we need to figure out before us as a board can make any decisions. So I was kind of advised, like, well, don't put the carriage in
You're
front
right,
of the horse.
yes, all right.
So don't start making all these programs or initiating anything until we get this interlocal
You
agreement.
and all of that.
Yeah, exactly, because we still haven't even identified a funding source.
Right.
for that matter.
They're still, yeah.
So,
The city manager was there yesterday and was saying the same thing. They're still working on seeing how they're
right,
gonna.
so I would hate to waste anybody's time in formulating a plan when we still don't even have an interlocal agreement, which is step A. So
Okay.
that's what I have on the detox.
All right, thank you. And the last one is transition and aftercare.
That's me. I wanted to go ahead and use this meeting to go ahead and request people to come on either the 15th or the 22nd. But you're in this one too, Mara?
I am.
Okay, so I don't know if that's good for you,
The 15th?
15th or 22nd at 5:30, and I don't know, we can meet here or we can meet at my company, it doesn't matter. Yeah, for
With our
the
doors?
preliminary,
With our
yeah.
That's very good. Meet at her place.
Yes, of
We've already
course.
done that.
We'll have a preliminary meeting, basically as a fact finding meeting, to see about who's doing transition living here right now, and what does it cost, what does it entail, and what is it out of Laredo, what are the best, how can I say, ABC, from your lowest to the highest, quality of care for transition living. What is there available now? So some people say there's something available now, but I was not aware of it. I don't know if anybody else is. And the only one that I'm aware is the one they mentioned through Bethany House, right? But nothing really from, like what we need, let's say for somebody like my daughter who goes to rehab for a year, and then she should not be allowed to come back home. She should have to go through transition living. And I think everybody should that go, because the city's already spending the money, or the taxpayers already spending the money, for her to go through the Odyssey 1 time, 2 times, 3 times, 4 times, 5 times, for her to keep,
Relapse.
relapsing, because there's never been transition living or order transition living for her to go to here or there. So it's just the money gone down the drain. And that's another story, but I think that the places that we choose, or the courts choose to send them, should really be looked at, because when you have peer counseling and not real true counseling, they're not really getting help. It's just a warehouse to keep these girls in the very worst conditions, and they're just getting meaner and angrier and not getting helped at all. So I talked to Laura Silva from Silva Mind Control. She's willing to come into the jail, because we have a captive audience right there, to see what we could do with mind, body, soul, alternative type of help that's not, you're a bad person, you're a criminal, you're this, you're that. It's more of a true rehab of mind, body, and soul. So she wants to be included in the transition living part of it. So that's as far as that. Yeah, so I've gotta have, so I just need these people's phone numbers. I don't have a way. I think Mara, because she's on the email thread, but I don't know, are they all on the email thread?
They should be, yes. It's,
Are
they're
any of
stakeholders
the-
or
Are
board
any of these
members.
people here,
No,
besides
that's why I
Mara?
called
Oh,
names.
okay. So I don't know what day works for you, or shall I send
can-
everybody an email
Is there a way we can do before 5?
before 5?
I'm
Yes.
available the 15th and the 16th.
On the,
Lunch?
you're related 15th, you're available on the 15th or the 16th?
I can do the 15th at 3.
The 15th at 3, the 15th is a Wednesday at 3. Yeah, I can do it 15th at 3.
Okay.
actually.
And then we can get the
At,
phone numbers or emails.
at
from-
3, and so we don't always know if this is available, and, we can meet at my office, so whatever way you want.
Yeah, the county judge's office is available also if you guys want to meet there. Or I know actually Reina Carrillo, they have a nice conference room also.
Okay, so where, who,
Our office is available if you guys want to go to the office,
okay,
the county judge's office
At 3 p.m.
at 3 p.m.?
at 3 p.m.
Okay, do you wanna send me
I'll
something?
send an email.
Okay, and Mara, so whoever wants to join us for the transition meeting, it's transition meeting. that we're trying to get.
When did you say the 15th or
The 15th at 3 o'clock at the judge's office?
Yeah.
Yeah, at the judge's office at 3 o'clock.
Okay, that's the stakeholder updates. Do we have anything for staff? No? Is there anything else? Anyone have any announcements? Yes, sir?
Yes, we're talking about the city and the county still having issues about who's gonna do what. And I think, Jesse and,
James,
yes, when we talked about getting some data on the cost of what it's costing the city. An example, yesterday, family calls, the 911, the ambulance gets there, picks up a guy for alcohol, takes him to doctors, okay? This is, I think, the 7th time in the last 3 months, that same person, okay? So I don't know what the cost is of the ambulance, but I'm sure it's $500, okay? And then, or more. Plus the,
I think it's 1,500.
somewhere around. yeah.
Okay.
Yeah, it's close to 2,000.
Yeah.
for one trip,
Yes.
okay? And he spent 3 days at Doctor's Hospital,
For
Free.
alcohol.
just for alcohol.
Alcohol
Okay.
poisoning.
No alcohol.
Just
Overdose or
Yeah.
over.
Seizures, you know, and,
Oh.
Going through withdrawals or what?
yes, because he wasn't able to, he usually can't get the alcohol on Sundays. So on Monday,
it's sick.
yeah, and when you're drinking that heavy, just those 15 hours, you know,
You can die.
yeah,
Really?
yes.
Now, my understanding, and this is something that I wanted to mention yesterday, this is gonna be for opioids.
For all?
Opioids.
Oh, the opioids.
Not alcohol.
Oh, no.
I wanted to mention that, but we were focused on opioid.
For detox?
Yes.
Oh, my God, no.
We can, I mean, that we can
Yeah.
mention later.
Yeah, it
What
should
I
be-
You
get,
don't die from opiates, okay, you die from alcohol and
Yeah.
benzos,
And who made that decision?
no, it is not a decision yet, but we were discussing the detox center around opioids. The only reason why, because as a stakeholder, the money or the grants for
Yes.
pushing now is on opioids.
Yeah.
It's not on alcohol.
Oh,
So we
you
can
it
get
both?
funded
Can you
for
get
that.
both?
We can get for both. It all depends. Now, what I can.
we're gonna have to have multiple
Yes,
sources of funding.
yes.
Okay, and one of them will be
Yeah,
with
that-
all the monies that the federal
Exactly.
government is putting out for opiates.
Yes, that would be the idea.
Now, the question about, the hospital was asking you if it's gonna be drugs
Right.
or the mental illness. It's a detox. Once, I mean, if they're under the influence, they detox, then
Then they
they
get-
evaluate them to see whether they have the
Double
mental illness.
diagnosis of what do you
Cor-
treat first, the mental.
Well, first you detox.
Detox, yeah.
And that's what they're fully aware of, that they first have to detox, and it's
Right.
like, okay, where are we sending them, and then after that, where do we send them?
Yeah.
And that's where we tried to say that we've been working on a gap system, where are we fulfilling, for example, this gentleman who's been going to the hospital a couple times.
7 times.
More than a couple of times, 7 times, what are his resources? Has he been
Yes.
helped in one way, shape, or form?
He has been helped. He's going, as a matter of fact, he should have been in, up in Dallas today. Didn't make it. So we rescheduled it for Monday.
You know, one of the things here, if you make the observation on this group, you see Border Region. Border Region has to be, a big part of it.
Oh, all of the agencies.
Yeah, but I'm talking primarily of Border Region because of the mental illness, when you're talking about newly diagnosed.
They have to be in all the groups.
Probably, there's a high
Yeah.
probability that a lot of these individuals could already be active consumers at Border Region. So that means that, you detox them, then.
They go there.
An MOU with the Border Region.
Yeah, they mentioned that before after detox, they were mentioning where we're gonna send them, who's gonna treat them. So what we're gonna try to do, according to what was discussed yesterday, SCAN has an in-house rehabilitation.
Level 2 intensive
Level two.
residential.
It's not medical, right? It's not a medical residence. So the one
But they allow them to bring medicine in.
oh yeah, but they don't have doctors in-house, right? And that was one of the questions, and I said, no, I don't think it's medical.
Well, we've also been discussing at that same location there, the juvenile. There's enough room in the back to maybe do detox and then intensive residential there.
That may
And
be,
then transitional living.
that may be the next step. but the current stage.
First
step
thing is gonna be
pretty much it's gonna be detox.
Yeah, but remember, level 2 is a fraction of the cost. And I guarantee you, we can get funding
For that.
from local for the beds, okay?
So the hospitals, what they're doing, many of these overdose patients, most of them, they don't have insurance, they don't have work, they don't have the means to pay the bill. So for them, many of these patients represent a loss. Liability, loss, uncompensated care,
Yeah.
and that goes maybe up to the millions. That's why they're interested, because if they can transfer the patient to the detox center, that's gonna be a benefit for them. So the stage right now is the hospitals are doing their numbers, and then they will give us some
And it's a benefit to the city and the county
to
also.
everyone. Yes.
You know, just the
Yes.
city, the ambulances.
Yes.
EMT,
EMTs, they mentioned, not over the tip, but we were discussing on the side, they can provide staff. That's gonna be a no.
For the hospital?
Yes.
No, we don't want their staff.
No, so
Pillar
more,
can provide
Yeah,
staff.
no, the
Yes.
staff, don't worry about the staff.
Yeah.
We've got,
And other-
more
we need
than,
just the funding.
more than likely, they're probably gonna help with the
Cost.
cost of the
Mhm.
building, and they will pay for referrals. Like, I'm gonna send you this patient, I'm gonna pay you this, I'm gonna help you with this amount. More than likely, that's gonna happen. Once we have that up and running, we can apply for grants, for
Private funding?
private funding. I mean, you're gonna have even cases of private
Insurance. Of course.
or citizens willing to pay the service. You will.
Yeah.
But that's the stage. I think it's gonna happen. It's gonna happen. It's needed. It's not gonna get better. So hopefully.
It's too costly even for the well-being.
it is, it is.
Yes.
Okay, any other announcements? All right, then, we've gotten to the bottom of our agenda in record time. And it's time for dinner. Do we have a vote or a motion for adjournment?
Motion for adjourn.
Second.
First and second, call for the question, all in favor? Yay.
Yeah.
Motion passes.